Welcome to YARKUD International. Today we are going to see the Saudi Prometric exam question and answer discussion from the maternity topic. Okay, let's see the question answer one by one. First one, a 30 years old gravida true, para 1, at 38 weeks gestational, present with the rigid abdomen. She rates the pain at the level of 8 on the scale of 1 to 10 and says that it is constant. She has vaginal bleeding of dark red blood with clots. She reports that the pain came on suddenly. What is the most likely health problem they are asking? This is the question. So here, options are placenta previa, molar pregnancy, placenta abruption, rupture of membrane. Okay, so these are the options. So here the rupture of membrane, as we know, there is a amniotic fluid will be ruptured and came out. So it is not about amniotic fluid because there is a dark red blood. Okay, so we can leave it. And placenta previa, placenta abruption, molar pregnancy. So molar pregnancy, as we know, there is a tropoplastic disease. Okay, it is the tissue growth inside the abnormal tissue growth inside the uterus. So these also not possible because there is a 38-week gestational already. So there is a chance of placenta previa, placenta abruption. So let's see what is placenta previa and placenta abruption so that you can easily answer the question, any question from the placenta previa and placenta abruption. Let's see. So this is the difference between placenta previa, placenta abruption. What is placenta previa? You have to remember attachment issue. There is a placenta should be attached in the upper part of the uterus. But now, because of the abnormality, placenta previa, the attachment is lower. So it is usually calling, there is a lower lying placenta. We will call usually lower lying placenta. Okay. So there is a different degree of the category will be there. It will be the what is the symptom? It is important. The placenta previa, it is bright red blood. There is a fresh bleeding will come. Okay, bright red color. And there is a visible bleeding. You can able to see the visible bleeding. And painless. There is no pain. If you see the abdominal, it is soft, non-tender uterus. Okay, so there is a palpation. You can feel the abdominal uterus soft only. There is no pain. Okay, so this is called the placenta previa. Got the point? Next is called placenta abruption. That means there is a placenta will be detached from the uterus before the baby deliver. Okay, that is very serious condition. So here the dark red bleeding will be there and there is a concealed bleeding. What is called concealed? The bleeding won't be visible. Sometimes inside there is a bleeding. We cannot see visibly in the outside, but the placenta previa we can able to see it. Okay, and there will be the pain in the abdominal and uterine. Okay, placenta previa, no pain. Placenta abruption, there is a pain is there. Okay, got the point? So this about the placenta abruption and the placenta abruption. One more thing, there is a fetal distress is severe. Fetal, you can just visibly see the fetal distress because the placenta is detaching. Placenta only connect with the fetal and giving the nutrients. Okay, oxygen supply. Now it's coming detachment. So there will be the big problem for the fetal also. Got the part? So this is about the placenta previa, placenta abruption. Okay. So let's see the question now. You can able to find out easily. So here they have given the key points, rigid abdominal, and there is a pain. Okay. Pain is the level of 8. Okay. And there is a vaginal bleeding, dark red blood. Okay. So this and all will be considered as what? Dark red blood. And there is a pain. There is a rigid. Okay. Abdominal will be painful and rigid abdominal, rigid board like abdominal will be seen. Okay. Placenta, what? Abruption. Okay. The answer is placenta abruption. So any question from the placenta abruption, you can easily find out with these symptoms. Okay, got the point? Let's see the next question. A pregnant woman at 33 weeks gestational came to emergency room with a sudden painless vaginal bleeding and her abdomen is soft and palpation and painless. What is the most appropriate diagnosis? Okay, what is the painless bleeding here? Painless and bright red bleeding will be seen for the which patient? Will be placenta previa. Okay, so here the option is the placenta previa is the answer. Got the point? Okay, this is about the two questions. Let's see the another question from the maternity. A nurse is assisting during a normal vaginal delivery. On 22 years diabetic patient, the head was delivered without any complication. Head suddenly retract against the perineum, urging the physician to immediately ask for the nurse assistant with this dystocia. Okay, so prompting the physician, something has to do because there is a suddenly retractor against the perineum. Okay, head is suddenly retract against the perineum. It's not coming out. Okay, there is a dystocia means difficult labor. Okay, which of the following will be the nurse appropriate action? Impacted shoulders of the infant. Okay, so now you have to remember the head came out, but the shoulder not coming. You got the point? So suddenly the prompting the physician, that means the physician is calling the nurse assistant to do something. Okay, so which has to be done for the nurse? Okay, nurse will do what? That is the question here. Okay, for the shoulder dystocia, there is a difficult labor for the patient. Okay, here the main point you have to remember, diabetic patient, there is a big baby. That is a problem. Okay, there is a macrosomic baby will be for the diabetic mother. So there is a always there is a problem with the shoulder delivery. So shoulder dystocia is commonly happen. So what is the treatment for that? What is the remedy we can do during the delivery? Like this happen, head is came out and shoulders not coming out. The nurse should do the perform suprapubic pressure to release the anterior shoulder. That is the correct answer. Okay, got the point? Nurse should be perform suprapubic pressure to release the anterior shoulder. We have to give the pressure in the suprapubic area. Okay, got the points? This about the diabetic patient, shoulder dystocia patient. Got the point? So, if any question from the diabetic mother, you have to remember baby is big, macrosomic baby is the one of the biggest complication. Okay, got the point? Let's see the next question. In teaching a female client who is HIV positive about pregnancy, the nurse would know more teaching is necessary when the client says, okay, this is about the question of the HIV mother. So something she is telling, HIV mother. So that one is wrong. That's why they need the teaching necessary. Got the point? So you have to understand the question first. HIV patient, pregnant patient, teaching done by the nurse. But when the mother is verbalizing, she is telling something wrong. So she needs the necessary teaching more. Okay, so you have to find out which statement is not correct. Got the point? So option A, the baby can get the virus from my placenta. It's true or false? Yes, the baby can get the virus from the placenta, but this will be the true one. So no need to be further teaching. Okay. So next option, I am planning on starting on birth control pills. Yes. Okay. So they have to plan for the birth control pills. Okay. To just plan the child. Okay. So that will be the correct answer. No need to further teaching. C option, not everyone who has the virus give birth to the baby who has the virus. Okay, so what does it means? All HIV mothers, not HIV baby. Okay, that will be the treatment is there going on. So there is a chance of getting the non-HIV baby also. Okay, because nowadays from the prenatal and after post of delivery baby also getting the antiretroviral therapy. Okay, so this will be the not everyone who has the virus give the birth of baby who has the virus. Okay, there is a chance of getting the non-HIV baby also. Okay, so this statement also correct. So next one, I will need to have a C-section if I become pregnant and have a baby. Is that correct? Every HIV patient we are doing C-section? No, it's wrong. Okay, so for the HIV patient, they can be normal delivery most of the time because there is a patient will be having the problem of the HIV virus. When there is a long as your viral load remaining undetectable, okay, viral load is remaining undetectable, they can be have the normal delivery, no problem. Okay, so it is the wrong point. They can be have the normal delivery. So if they get pregnant, only C-section, no, that is not the correct. Okay, so this need the further teaching, necessary teaching for the patient. Got the point? So like this wise, you have to understand. Some questions are difficult to understand, but still you have to be try to understand this way. Okay, got the point? So here the HIV patient, no need for C-section alone. They can be normal delivery. Okay, so here this statement is wrong. This is need the necessary teach. Got the point? So these about the today's section. There is a maternity questions are discussed. So in further video, we will see the specific topic with the more question and answer. Here, the YARKUD International, we are giving the online training for all nursing examination like Prometric, SNB, Oman Pearson View nursing examination, MOH, DHA, HAD, OET, and IELTS.